Our daily update on the spread of COVID-19 and the interventions being made to check this spread. We are now being joined from Arise Abuja studio by Dr.Chikwe Ihekweazu, an infectious disease epidemiologist and consultant in public health medicine, who is at the moment the Chief Executive Officer of Nigeria's Center for Disease Control. Dr. Ihekweazu, thank you for joining us on the morning show. Good morning.
Thank you.
Yes.
Thank you, Ruben. Good morning,
yes,
Nigerians.
Good to have you here again. Well, I don't envy you guys. Very difficult moment for everyone in the world. But yesterday, we were told that some foreign airlines, Air France and is it KLM, came to Nigeria to evacuate the nationals of those home countries of those airlines. And that sent a very strong signal that, what would France and the Netherlands and other countries be talking about evacuating their, citizens from Nigeria, when in actual fact, if you look at the numbers in Nigeria, it's still considerably lower than what you have in many countries in Europe. Is there something that those other countries know that we do not know? Is there something that Nigerians need to know that we have not yet been told? And the figures that have been published, as of yesterday, your agency reported 65 total number of confirmed cases. Is there something we need to know? Because that was a very strong signal. Otherwise, you would think that a country like Nigeria that treated the index case successfully should not be a country from where other countries would start evacuating their nationals from.
So, Ruben, thank you very much. There's never been an outbreak that has been reported in real time around the world the way this is being reported. We have seen the first wave of this outbreak go through mostly China and some other countries. We've seen a second incredible wave now going through Europe. And unfortunately, we're seeing the beginnings of what is most likely to be a third wave starting off in many countries in Africa, in South America, and in Southeast Asia. There are many reasons for this. Not all of them are fully understood, but we have to know that this is a new virus for which we're learning about every single day. And there may not be any straightforward answers the way people are used to give it. All we can promise to do, especially at the Nigeria Center for Disease Control, is to do our very best every day to keep Nigerians informed, to get the numbers right, and to publish them. Now, if countries in Europe or anywhere in the world decide to take away their citizens, it's their legitimate right to do so. It's no news, it won't be news to any of us that the capacity of healthcare systems across the world to manage will be different because of the difference in socioeconomic status, the difference in technology, and the difference in investments in healthcare systems by different countries. So if one country decides to take its citizens back home because they have greater confidence in their healthcare systems, that will not be a surprise to any of us. But what we need to do is focus on the problem at hand very deeply. You mentioned the first index case in Lagos that we managed fairly successfully. That bought us a fair bit of time. The truth of the matter is the expansion of cases in Nigeria has nothing to do with that case. There have been multiple seedings of new infections. Every single new infection has the potential to become an outbreak, and we have had several. Mostly in Nigerians returning from Europe. This is their country. We can't stop them, so we do the very best to follow up with them every day. We have a whole team of people calling these returnees every day to make sure, at least as much as possible, we know they're in good health. But really, that's where the current cases, most of them have been in returning travelers. We continue to work to see that we limit the expansion of this outbreak from these people. But remember, this is an infectious disease. It's not a crime, you know. People got it. Nobody wants to be sick. So we have to be compassionate in our care. We have to be responsible to the public at the same time. Not always an easy choice to make, but that's what we have to do. Now really is a time to come together. I cannot say it more often. You know, the looking for faults in individual responses here and there is not going to solve this problem. We have seen the most advanced countries in the world, countries that we have looked up to for generations, struggle to manage with this. Now is the time for Nigerians to come together and not to blame one agency or one individual, because none of us can solve this on our own. We need to come together to face this challenge as a country, as a community, as a people.
Indeed, Dr. Ihekweazu, we do appreciate the work you and your team do at the NCDC at this time. This silent enemy that no one sees coming is the coronavirus itself. But let me ask you, yesterday we saw 14 recorded cases. This is the highest number we have seen in a single day. Is this as a result of increased testing, improved contact tracing, or more infections being recorded at community level? What exactly is responsible for this? And is this a pattern that we should brace up for to see more numbers?
So firstly, thank you very much. I want to give credit to the incredible work being done, particularly by the government of Lagos State. Lagos State has really shown leadership from the level of the governor to the commissioner to the entire EOC team. Our team is there to support them with the World Health Organization, but really Lagos State is leading from the front by instituting measures and applying them every day in very difficult circumstances to limit the spread. We had 14 new cases yesterday. 6 were in a particular cluster, slightly unique circumstances, but it's a combination. What is leading to this is a combination. Now, travel has been stopped into the country, so there are very few new seedings that are coming in. But we have to remember the incubation period, we have a maximum of 14 days incubation for this particular virus. So many of these are people that have come home a while ago. And of course, some of them have started transmitting. We've had a handful of cases that we can't really say where they got the infection from. So thankfully, they're still in the minority, but there's a combination of things happening where seeing real new cases because they're becoming symptomatic 7, 8, 9 days after arrival. The average is 5 to 6 days, so most will become symptomatic after 5 to 7 days. The second is we're scaling our testing capacity across the country, particularly in Lagos. So we're testing more. People are more aware. So everyone that has a severe respiratory illness or even mild symptoms is coming forward and pushing to be tested. We apply the case definition, but sometimes we just have to go ahead and test. And you know, we're generally improving the entire system from collection to testing to sending results. So it's a combination of those factors. And I don't think it will be, it's unlikely that we will see a series of new cases, a continuous increase in the short term as the measures that we have instituted and new measures that will be instituted inevitably become effective over the next few days.
Well, Dr. Ihekweazu, yesterday, earlier on you said, you know, one of your commitments is to get the numbers right. But when the NCDC announced the 14 additional cases yesterday and a total of 65, the initial announcement that went out, the arithmetics didn't quite work out well, because when I added the numbers, I got 10 instead of 14. But later I saw a tweet which corrected that. You know, how did that error occur in the first place? But beyond that, in the breakdown, we were told that 6 of the infected persons came in through vessels. Could you help us shed some light on this, considering the fact that, look, countries around the world have taken steps within the shipping industry to make sure that any ship that is coming into the country is quarantined for 14 days. Some countries have even said vessels that have been in some countries, high-risk countries, should not even come to any of their ports at all. And, you know, the International Chamber of Shipping has recommended exit screening processes. I know the president referred to, something about vessels coming into Nigeria yesterday. But how come we had 6 cases, of persons coming through vessels when we have the advantage of what happened with the Diamond Princess and efforts that have been made in other parts of the world? If you could help us shed some more light on this so that, we can know what is actually happening with the shipping industry and vessels coming into Nigeria.
Yeah, Ruben, like I said at the beginning of the program, we're managing this outbreak in real time, in the full view of the world. So normally in the past, we would have a time, we'd report the number of cases daily or weekly. But because of the level of visibility of this outbreak, we have a responsibility to report the numbers as quickly as possible. And there's always a trade-off. How quickly do I report, and then incur the wrath of Nigerians for not reporting quickly? Or how much do I wait to get every bit of information 300% right in order to respond? This is a difficult balance to find, but one that we're looking to improve on every day. So in that process, there will be minor errors here and there. I think, like you rightly reported, the role and what a responsible agency should do is when it does find a problem, to report it, correct it, and be open to Nigerians, and that is exactly what we did. In terms of the vessel, there's also a lot of misunderstanding on this. I mean, there's great credit to the work of Lagos State Government and Port Health Services. This vessel hasn't actually berthed in Nigeria.
Sorry to interrupt you. We'll take a short commercial break, and then when we come back, we'll continue with the conversation. Please stay with us. Welcome back to the morning show here on Arise News. Still with us in our Abuja studio is Dr. Chikwe Ihekweazu, the Chief Executive Officer of the Nigeria Center for Disease Control. Yes, Dr. Ihekweazu, I interrupted you earlier. If you may just conclude your thoughts. And when you finish with that, I would like you to tell us about mass testing. Yesterday, in the papers in the UK, we were told that mass testing is a game changer. And the UK authorities are trying to do a lot in that direction. The Director General of the WHO also says, test, test, test. Do we have the capacity to test? We've been told that so far, Nigeria has only been able to test only 178 persons. That's scary. So what measures is government putting in place to accelerate testing? Even in the United States, which has overtaken China, President Trump, when he was confronted with the facts, said that, well, whatever they've been able to do is a tribute to the fact that the U.S. has been testing and testing. Are we testing enough?
So thank you, Ruben. Now, to conclude my thoughts and my comments on the vessel you spoke about, there's so much work going on this outbreak. People just have to give us time to get to the root of the matter. There was a vessel on its way from Port Harcourt to Lagos. The vessel has not berthed, but was close to Lagos. We had a sample sent to Lagos, to the lab. There was one positive among them. The crew was then examined. The vessel was approached by helicopter. 53 members of that crew of the ship were tested. We got 5 more positives, making 6. This is unbelievable. In Nigeria, we're actually boarding a ship that hasn't berthed, testing everyone, understanding the infections that are about to come in, stopping them from coming in, telling Nigerians, listen, we have 6 people in a ship, but they haven't actually come into the country. I mean, I can't imagine what better public health there is than that. So Nigeria should rest assured this ship hasn't berthed on the port. It's still at sea. We did the right thing. We shared the numbers. Absolutely no controversy about it. So on the second issue you talked about, on testing, there's no doubt, when the WHO says something like test, 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 WHO is speaking to 153 countries around the world whose socioeconomic reality spans from one extreme to the other. When the US and the UK talk about testing, their realities also are different from ours. The UK and the US has 24 hours power in every village in Nigeria. We don't have this. There's a reason for this. They have trains connecting every village in Europe. We don't have trains connecting every village. There's a reason for this. The reason is that the level of infrastructure that we have in Nigeria at the moment, with the only testing technology that is validated at the moment, which is molecular testing, we simply don't have the infrastructure at the moment to scale our testing capacity to the levels that have been talked about in the US and in the UK. The game changer for us will be if there's a rapid diagnostic test developed that can do this. I know for sure, because I'm involved in many of the global conversations around this, that everybody is working very hard towards this. But Ruben, there's no magic bullet. This is science. It can be slow, frustrating, but there's no alternative. It's just like the therapeutics. People think that, you can find chloroquine and there's some magic bullet. It can't. It has to go through clinical trials. And you can accelerate that to some extent, but you have to go through this process. So at the moment, the global message, yes, is test, test, test. But there are several limitations that we have. Now, I want to conclude by saying we are working extremely hard to increase our testing capacity. There's nothing more important to us now than to do that. But there are limitations in how quickly we can. We're doing process engineering to bring in more staff, to improve the capacity of the labs we have, to add a few labs to the network, to increase, to build completely new labs. But none of this, unfortunately, Ruben, can be done overnight. But we will keep pushing in that regard. The federal government has released good funds to do this, and we will keep pushing using all the resources at our disposal. At the same time, we will keep working with our global partners to see whether we can get a new test with new technology that can bypass all this very tedious molecular work and enable us to get to the end. But, everybody is being approached with rapid diagnostic kits, governors, commissioners of health across the country. Ruben, none of them have been shown to work. Some people in the private sector are offering them. Listen, I have bad news. None of them works. So please, don't go investing or using any of them for now. And let this science take its path. We will get there if we stay together. If we look for short-term solutions, we will get to an outcome that is not desirable for any of us. So we're working very hard to increase scaling capacity in Nigeria at the moment. And through that, we will increase the entry of people into care and therefore potentially be in a position to limit the spread of this outbreak. I cannot promise that I can stop this or that anyone can. But what we need to do is flatten that curve so our system has the capacity to manage the patients that will come into it.
Indeed, very pertinent. If there's anything we can learn from the US is that they've got the testing wrong initially and they are paying dearly for that at the moment. But two quick questions, Dr. Ihekweazu. A lot of help, both financial and material, seem to be coming your way as an agency. But tell us, are there still sticky issues? What are the most challenging problems for you? Perhaps the top three you are dealing with at the moment as an agency as you try to flatten this curve. Secondly, we do hear that your agency has given Lagos clinicians in Lagos a go-ahead to start clinical trials of chloroquine. Can you tell us a bit more about that? Because there's been a lot of controversy, between government agencies, the Minister of Health saying something different, the NAFDAC DG saying something different, the Lagos State Commissioner for Health saying something different, and your agency saying something different.
So thanks a lot for that. I think let me clear that up from the very beginning. NCDC doesn't have anything, any responsibilities around clinical trials. Our goal is to choose from the various therapeutics available that have gone through a clinical trial and make them available to Nigerians if it's for an infectious disease. So we don't regulate the clinical trials at all. And now to your to the support coming into the agency. Firstly, let me clear up one thing as well. the best type of support is support that goes directly to solving a problem. To be honest, if you can solve that problem directly, you don't need to send any funds to the NCDC. So there have been some great private sector initiatives over the last couple of days. There's been efforts to increase the clinical care provision. So by building new treatment centers, big spaces where lots of patients with mild to moderate symptoms can be managed. There's a big initiative around that in Lagos and a similar one in Abuja by some of our greatest entrepreneurs in the private sector. So that's excellent. And that's the type of thing we like to hear. There's a great one by Nebong Abasi pulling together a few private sector actors to do some work in setting up a new testing process using the private sector and running with it. So no funds are coming to NCDC directly from any of these, but they're solving some of the problems that we have. So that's great. Other than just investing in risk communications, on NTA, on many of the news channels, you would see our jingles and messaging being showed pro bono every hour, several times a day. This is great help for us. So we continue to encourage everyone. Most of the things we need are not for NCDC. Do it for the public. Do it for healthcare professionals. Support the incredible healthcare workers. People have gone to IDH, the treatment center in Yaba, and donated food to the people working there. Great initiative. There's a small restaurant in Lagos that brought packs of food to our teams and the Lagos State team working. Great initiative. So we're calling on Nigerians, big and small, to support the response. Supporting the response doesn't mean giving NCDC money. No. Do whatever. Of course, we need a bit more money to do the work we're doing, absolutely. But the bigger need is by providing care, helping us improve our lab processes, and most importantly, supporting the incredible work healthcare workers are doing in Lagos, Abuja, and many other cities where we now have a few cases being reported.
Well, Dr. Ihekweazu, there have been complaints about having access to the helplines that have been announced, those toll-free lines. And some people have said they sought help, they didn't get quick response, or, there were complaints on the other end about where they should be looking for help. What are you doing to make sure that those helplines are accessible and that help is provided immediately?
Yeah, Ruben, you're absolutely right. I will not hide and say there wasn't a problem. The demand for on the helpline increased about 1,000% in a day or two once we started seeing new cases. So yes, over the last few days, there have been delays. I put my hands up and say, yes, there have been delays. What you would notice, and I think Nigerians will bear me out, the last 1 to 2 days, those problems have been reducing because we have exponentially expanded our capacity. When you bring in new people, it's not an automatic service. You have to train them because the answers are not straightforward. They're complex. So we've introduced more people. We've introduced different layers. We've introduced supervision during their work. So we have increased our capacity. But I am holding my hand up saying, yes, the first days we were extremely overwhelmed. The number of calls coming in increased 1,000 times. We are sorry about this if it caused any pain and disturbance to some people. Please bear with us. We are working very hard to improve on this. And anyone that has followed our service and followed the calls will see that in the last day or two, the complaints have reduced, and I think we're now in a much better position to scale even further. We've got a lot of help from the private sector.
Well, but sorry to interrupt.
Yes,
but
we
are
are.
You getting any help from the telecommunication companies? Yes. Because I understand some of them say they've offered helplines and that, those helplines are not being taken.
That's not true. We have gotten help from both MTN and Airtel. I will say it publicly. The challenge we have, Ruben, and I will also say it publicly, we actually approached all the big telcos to support the work we're doing for many years. And this is the fact. None of them came to the table. But we are happy that they're coming now. But when you come to support a war, when the war has started, of course it takes a few days to integrate what you've offered into the service being provided. None of them is a plug and play. You know, you have a service being already provided and you want to switch over in 24 hours. It just doesn't work. So we are process engineering that at the moment. And we really want to share this as an example. We have approached the telcos over the past 3 years. These are our needs. This is where you can support with existing infrastructure. Not doing anything new, not giving us money, just using some of your redundant data and airtime to support a public service that is so important to Nigerians. Ruben, none of them did this. So right now is not the time to hold NCDC responsible. It is time to call on corporate Nigeria to take up these responsibilities where they can, with any redundant capacity that they have. So we're very grateful to MTN and Airtel specifically that have now come to our assistance. It's better late than never, and we're grateful and we're integrating the support they have so gracefully provided to the services that we're offering Nigeria.
On deck to flatten this curve, as you have said. But two quick questions, Doctor, here. I want to follow up on Nigerians who have been calling those lines, and indeed we understand how overwhelmed you are. But what do you say to Nigerians who say coronavirus is the problem of the rich man for many reasons? Most especially, they say when they call or they see people who have called, they are told to isolate until they see symptoms and then call for help to come and be picked or tested. However, in recent times, they've seen top government functionaries and officials who have been tested or talking about their test results without showing symptoms, only just because they've been exposed to infected cases. How do you clarify to those Nigerians to say, this is not a rich man's problem, it is everybody's problem? And then you've deployed a lot on social media, which is great, but there are so many Nigerians who are not on social media. How are you reaching that target? What are you doing? And how can we help?
Yeah, so this is definitely not a rich man's problem. You know, when an infectious disease doesn't really understand who is rich, who is poor, who is left, who is right, who is black, who is white, it's a virus. And so we have to keep working together. I can't comment on individual circumstances because I don't know what they are. But to be honest, this is everybody's problem. In Nigeria, we all live together, and that's the reality. Even if you're rich, you live with your driver, you live with your gate man, you live with your nanny. All of them are just as exposed as you are to any infection that might come into your home. Our nannies look after our children for those that can afford it. Those that can afford it have drivers driving them 24 hours. They sit in the same car. So anyone that thinks that his wealth or his social status is going to protect him from this is completely mistaken. So there's been no better time to come to Nigeria, to come together, to work together on this. Now, so, you know, whatever the stories are, please bear with us. We'll come to everyone as we proceed on this. Remind me of your second question.
Yes, how are we reaching those populace at the rural areas?
Yes, sorry, on our communication efforts. Yeah, so the social media is just the visible part to those that follow social media on what we're doing. Right now, campaigns are being developed and are being executed and will be scaled across the country, across all the languages. This will focus on Lagos in the first place, Lagos and Abuja, because that's where most of the cases are. But at the moment, we're going to scale across the country. You would have already seen, if you still read newspapers, you would have seen in every single daily last week, there was the big full-page color advert describing what everyone should be doing. Radio Nigeria, all the radio channels have been airing jingles, reaching the millions of people that Nigerians listen to a lot of radio. So we're doing a lot of radio. We're translating this. We've done this in the 3 major Nigerian languages, but we're going further to the other Nigerian languages, to Pidgin, which most people also understand. So there's a lot of effort going on. You know, depending on what you are watching yourself, you might not see what everyone else is listening to. But every morning I get up, I ask people around my house, the drivers. I asked them, what have you listened to? And everyone is talking about this virus. And I'm happy about that because the message is going far and it needs to go even further as we try to reach every Nigerian, because there has never been an infectious disease where people have to engage to stop transmission. You know, for all the others, there's been a big responsibility on government to do this and to do that. But actually, for coronavirus, the thing that will stop transmission depends on individuals, because we have to limit the contact we have with each other. And it's a very difficult thing. It's what we call social distancing. It's a nice word, but in day-to-day life, it is hard. I know because I've had to do this myself. And every day it is hard. You meet someone new, you can't hug, you can't shake hands, you can't carry out the things that are part of our way of life. So we need people to cooperate, and it is hard. But there's no other way, because if people cooperate with us and with themselves and with each other and hold yourselves accountable, so when you see someone stretching out his hand by mistake, you know, you be the person to hold that person to account. So like no other time in our history, we need Nigerians to come on board and to take responsibility. And that has been our message through all our channels. We have a campaign about taking responsibility. There has never been a time that the future of our country, our ability to control this outbreak, does not depend on NCDC. It depends on you.
Well, Dr. Ihekweazu, I mean, we started this with prevention, then we moved to the point of containment. And this week, we saw the numbers just going up, almost astronomically, if I may use that phrase. If we get to a point of an explosion, of very serious escalation, as we have seen in Spain, as we have seen in Italy, as we have also seen in the United States, do we have the capacity, the infrastructure to deal, for example, with an Italy-type situation? Do we have enough ventilators? Do we have enough medical personnel? Do we have enough isolation centers? Because many Nigerians, when they heard, whether that was true or not, that the chief of staff had to be taken from Abuja to Lagos, many were concerned that, look, are we really prepared for this pandemic?
Yeah. So, Ruben, to be honest, it's a race against time. Where everyone is working extremely hard at the moment, public and private sector. There are some great initiatives happening now to set up new treatment centers in Lagos and Abuja now. We're extremely grateful for those. That needs to happen in other Nigerian towns as well as we prepare, because most of the people infected will have mild to moderate symptoms. They will not need high-end facilities in the hospital. So we need to preserve the hospital services for those that are severely ill. And so in order to do that, we need to have alternative treatment and isolation centers where most people that don't require ventilators and the rest can be put together safely. And now that is happening. It's happening at speed. It's happening by both the public and private sector working together. Are we ready now? We are not, but we are working and increasing our level of preparedness every day. So we have a certain level. Every week we set new targets for ourselves. The Minister of Health is completely focused on this, and he is himself going around every day, making sure we have new facilities, calling up the commissioners, asking every state governor to do the same. So in most states now, they have identified treatment centers, and we're calling on all the state governors to take personal responsibility to make sure that these places are ready. Because when it hits any part of the country, very often people don't take this seriously until they have their first case, and then their second, and their fifth, and their 10th, and suddenly, you know, it's rising. So we have to learn from Lagos in the work they have done. Lagos has really been a leader. It's not where it needs to be, because of the size of the city and the potential for further escalation, but really a lot of progress has been made. We are now calling on all the other governors across the country, the state governments, to identify treatment centers, scale them up, identify centers outside of your hospitals where you might need scale. This might be a convention center, you know, whatever redundant capacity is not being used, we use that for the mild cases, and we keep the treatment centers for the severe cases. So everybody is focused on this problem. them. Scaling treatment, scaling diagnosis, scaling information to the public. These three interventions are critical in getting the country ready for this outbreak.
Okay, you talked about scaling tests across the country. We do know that presently there are 5 laboratories. How soon do you think that we can get those additional testing centers? And we do have questions coming in from some of our social media handles. Some people are asking, would they be paying for this test? Also, how many numbers of Nigerians have actually been tested? They want to know. And then yesterday, the Minister of Information talked about Nigerians not being cooperative, especially those who are meant to self-quarantine if they had returned from high-risk countries or even any country that has recorded a case at the moment. 4,370. How is that going?
Yeah, so in terms of the testing question, before I come to the self-isolation question, in terms of testing, but in the short term, there are 2 short-term interventions that we're carrying out. Firstly is using some process engineering to improve the throughput in our existing labs. So in the Abuja lab at the moment, we have moved to a shift system. So we're working 24 hours in 3 shifts. And these are all public servants, remember. So we're working very hard to use some process engineering to improve the throughput of existing labs where they exist. Then in the next week, we're going to add 4 new labs to our network. So we've worked in Ibadan over the last couple of days. We should activate it today. I have a team that has been in Ibadan for the last 2 days. Then we'll go to Abakaliki where we have an existing lab. Then we'll go to Port Harcourt and Kaduna. So these 4 should be ready in the next week and add to the existing capacity. That's the first stream. The second stream is converting some of the high throughput tests available for HIV. Now, there's a PCR diagnostics test that can test a large number of cases at the same time. But the technology itself has to be changed and adapted for this new virus. So that will take 2 to 3 weeks. And then once we get in the reagents for that, then we can do some really high throughput testing and test thousands at the same time. But that will not happen to the next 2-3 weeks. So that's the second strand of expansion that we're working on. In addition, there's a new test kit called the Cepheid. It's a cartridge form. So we're going to order a few, and if it works, expand that capacity. The third stream is where you have new diagnostics. So the people working on rapid diagnostic test kits, how quickly that can be brought to bear in the market, and then we'll make our purchases, procurement as soon as possible. So there's a short-term, medium-term, and long-term, all of them happening in parallel. I want to assure Nigerians, they haven't paid for any of these tests. As long as you need the test, we will support that test through public sector funds. Of course, if you want to have the test privately, we don't have any private provision for as at now, but there are groups working on it. So if you want to have it in the comfort and you want to have it the next minute, then there may be a private sector provider that can offer that to you. But that doesn't exist at the moment for any validated test. But like I said earlier in your program, we're working with a group of private sector colleagues to make this happen in Lagos in the short term, and then in Abuja, and then we spread it to the other cities. Ruben, one last question, because it was a very important one, about returning Nigerians. Now, this is probably one of the most important interventions right now. 70 to 80% of the infections we're dealing with at the moment have been in Nigerians that have come back to their country. We're not saying don't come back, but please do carry out that self-isolation very strictly. We need you. We need you more than ever to stay at home, stay in your room, let your family walk around you for 14 days. If you're ill, let us know. This is really where the infections are coming from, and we need Nigerians that have come back home and their families, their mothers, their fathers, if they're students, to take responsibility for this. Stay in your room, manage yourself. If you need to come out to go to the bathroom, do that, go quickly back in. It's just for 2 weeks. It's a price you have to pay for the health security of our country.
Well, Dr. Ihekweazu, well, first let us thank the NCDC and all the stakeholders who have been doing a wonderful job so far of combating this, and particularly the medical personnel who are on the front lines. But we don't have much more time. I would have liked to ask you, whether in terms of lessons learned, in terms of cooperation with other countries and other agencies, whether there is a model that Nigeria is following, and whether we are seeking help from any country, say from China or from Cuba, as we have seen in the case of Italy.
So, Ruben, the most important lesson we can learn is to learn from what we're doing. You know the reason why China, Singapore, and the rest of them were prepared for this better than we are? They had a SARS outbreak about 10 years ago. That revolutionized their approach to health security. It made the investments after the outbreak that led to their preparedness for the one they faced this time. And that is why they had already a lot of systems thinking worked out that they have now used to respond to this outbreak. It's the same for Singapore, it's the same in Vietnam, it's the same in China to a large extent. Once they understood what they were dealing with, their response became so incredibly well organized. My message to Nigerians is we will learn as quickly from this one, and we will improve, because we are good at responding to emergencies. Where our challenge will be as a country is, can we learn in the long term? Can we learn from this to invest in health security, not just for now, but for the future? When all of us working in this response would be gone, I would be gone as DG, many of my colleagues would be gone. But as a system and as a country, can we make the health security investments to protect us in the long term? That is not just a challenge for NCDC, it's not a challenge for the federal government, it's a challenge for all of us as a country.
A challenge for all of us, but we would still see those who are recalcitrant and, flout these directives. As we trace these 4,370 contacts and perhaps increasing, would you suggest we go the way of South Africa, for instance, where the country is now charging 2 individuals for murder for not adopting self-isolation, even though they had tested positive? One case was a barber, a barbing salon, which he still opened and was rendering services to people. Do you think that Nigeria should go that way? Because the Minister of Information yesterday again talked about tougher measures.
So thanks. As a public health physician, by definition, our profession depends on winning the trust of the public. So yes, there are advocates for tougher measures, but I truly believe that to control this outbreak, we need to win over the trust and confidence and collaboration and cooperation of the Nigerian people. If we go too quickly into enforcement, people will go underground, and we have learned this from many interventions in the past. So rather than force people down, we need people to come out and to work with us, to support each other. And if they find someone flouting the advice that we've given, for another Nigerian to go up to him or her and say, listen, for these few days, do these few things that will keep all of us safe. I truly believe that the way for us to survive this as a country is to win over hearts and minds of Nigerians and not to force them. My personal advice, and of course, I don't completely enforce this, but my personal advice to my government is to continue working hard to win over the trust and confidence of Nigerians so we can be together. Once we're seen as adversaries and we have to roll out the army or the police to make sure we're washing our hands, then we have lost the battle, because we will never be able to completely enforce this through enforcement mechanisms. So the best chance we have is to win over hearts and minds so that together as a country, we can hold each other responsible to doing the things that we need to do together to get out of this outbreak.
Well, thank you very much, Dr. Ihekweazu. Thank you for your time and for your insights and for joining us this morning on The Morning Show.